So for environment and scene safety, we're going to remember the acronym PET AID, PETAID. And these stand for P is protect the pet, people, and yourself. E is environment. T is traffic. A is agencies and associations. I is injury or threat of life. And D is disease. So let's start with P, protect the pet and people. Always, if you need to, restrain and muzzle the pet for safety, so neither you, the rescuer, the patient, or bystanders is hurt or injured in the process of rendering assistance. Remember the motto, any pet in pain or moved into pain can and will bite. And we do know to keep in mind that we never want to muzzle a pet when they're vomiting, choking, convulsing, or having breathing problems, but we can restrain them. One of the easiest ways is to take a sweatshirt or a blanket or a towel and wrap around so that we can keep them from biting us, but maintain free flow of airway and breathing. Environment. We're going to watch for life-threatening dangers to the pets that exist in urban, rural, natural, and even groom shop settings. As a pet professional, you should be aware of the inherent dangers which environment presents to pets and humans. Take a moment to assess the scene for any dangers. So if you walk into the salon and you see a dog unconscious in the middle of the floor, take a breath. I always say this over and over again. If you walk away from here not remembering another thing, it's before you react, take a breath. Look around at the scene. Why is this pet unconscious in the middle of the floor? It could have had a heart attack and just laid down. It also could have been shocked. There could be a chemical in the air that made it go unconscious that you are now about to start breathing. So take a breath, be aware of your surroundings, look around, make sure it's a safe environment for you to react. Traffic is another big one. Common cause of preventable injuries to pets and humans is motor vehicle accidents. If you are outside near a roadway during an emergency, be very cautious of traffic. You may employ a bystander or coworker to assist you with traffic while you help the injured pet. If you are transporting the pet, you also need to properly secure the pet inside your vehicle to avoid injury or interference with the driver. I have heard stories of people putting a pet they found on the side of the road in their car to take to the vet, and the pet got freaked out and then started bouncing around the inside of their car and interfering with their driving and not being safe. So also, if you're crouched down on the ground with a pet on the side of the road, drivers may not see you down there. Have somebody help you with traffic control. Think about your environment. Your safety is number one. I know we all love all pets, especially the ones in our care, but your safety comes before theirs. So keep yourself safe before you jump in to help them. Make sure that you're not going to become another victim for emergency personnel. Agencies and associations. In any situation, you must yield control and decisions to authorities, such as police, EMS workers, veterinarians, and even county animal control. If a pet becomes unusually aggressive, immediately contain the pet and control the situation to avoid injury to yourself, other people, and other pets. Local animal control, humane societies, and rescue organizations should be considered as resources. So you've received this training here, and you're going to feel very confident, hopefully, in helping a pet. But don't let that confidence carry over into, telling police what to do or anybody else in the scene that's above you in the protocol ranking. Make sure you listen to local authorities and EMS workers and kind of deliver control and decision making over to them if necessary. Injury and life. There is only so much that can be done in an emergency setting. It is important to ascertain if this is a situation you can help with at the scene or if it may be best to immediately transport to a veterinary hospital. Life-threatening injuries like no heartbeat, no breathing, persistent and uncontrollable bleeding, broken bones, puncture wounds to the abdomen or chest, unproductive vomiting, severe diarrhea, or loss of consciousness are things that you cannot treat in an emergency setting or on scene. They must be treated by a vet. So just take a beat to ascertain if this is something you can help with in the moment or if you need to just immediately transport that pet to the vet. And then disease. Pets are mammals, as are we, and they carry many types of diseases transmittable to humans. These are called zoonosis or zoonotic diseases. Diseases can be contacted from body fluids such as blood, saliva, and excrement, or transmitted through open wounds such as bites and scratches. Use personal protective equipment, control the pet, and use sanitation procedures, and be cautious. Okay, so we're going to jump into CPR for pets. The main focus of CPR is our ABCs, airway, breathing, and circulation. As mentioned before, CPR is just manually doing what the body should be doing on its own as far as breathing and circulating the oxygenated air through the body. So when we come across any pet emergency, there are only 3 situations that we're going to face. Either the pet has a heartbeat and is breathing. In this case, your pet is in need of first aid. If the pet has a heartbeat but is not breathing, this pet is in need of rescue breathing. And if the pet has no heartbeat and is also not breathing, this pet is in need of full CPR. So to determine which situation you are facing, we're going to perform the primary pet assessment. So this is different from the snap to tail assessment. It should be done in less than 12 seconds in order to determine if this pet has the ABCs or airway, breathing, circulation. As mentioned before we start any emergency protocols, we're going to check our scene safety, make sure that we're safe and the pet's safe, restrain or muzzle the pet if necessary. And the first thing we're going to assess is the pet's responsiveness. So if he's breathing, he's going to be moving, growling. You'll see the breaths. And when we approach, say we have an unconscious pet on the floor, trying to get their attention. We have many old dogs. I know I personally had a dog that was super old and could not hear anymore and could barely see. And it would take me coming up and touching her before she'd realize anyone was even in the room with her. So if you have a pet unconscious on the floor, clap, stomp your foot so they feel the vibration on the ground. You can always say, hey pet, are you okay? Really loudly and forcefully. See if you can get their attention before you assume that they're unconscious. They may just be very deaf or blind or super old or sleeping very deeply. So if the pet's moving, growling, making noise, breathing, this pet is in situation 1 and they are in need of first aid. Safely control and restrain the pet. At this point, you can do a nose to tail assessment to find any injury or signs and symptoms of other issues and administer first aid as needed. Make your managers and others in the vicinity aware of the situation so that they can contact the veterinarian and the pet parents. If you find a pet unresponsive, unconscious, the first thing we're going to do is check for pulse. So we're going to kneel behind the pet. We're going to take our hand closest to the tail and place it on the chest, just behind the elbow or the top of the front leg. And note if you feel a heartbeat with your hand on the chest here. We're also going to open up the airway. So again, we're going to gently tilt the head back and extend the throat to open up that airway. And we're going to look, listen, and feel. So we've got one hand here on the muzzle, one here on the chest. We're going to look, listen, and feel for breathing and try to see if that pet's breathing. We may feel a pulse in the chest. We may feel the rise and fall of the chest when the pet's bringing a breath in, or we may even feel or hear the breath here at the nose. You can even put your hand gently in front of the mouth and see if you feel any breath coming in or out. If you do not see, hear, or feel anything, this pet is unresponsive and is not breathing and is in situation 2. This pet will require rescue breathing, but before we do that, we're going to move on to assess if the pet has a heartbeat immediately. To check for the pulse, we're going to slide our hand closest to the head, down the length of the belly to the groin area where we learned earlier to check for a pulse on the pet. So we're going to slide our 2 fingers, 1 finger, or even the flat of our hand into the crease between the groin and the back leg and feel for a pulse right in there.
Is that the same spot for all mammals? like animal mammal.
Yeah, the femoral artery for all
Inside the
mammals is
thigh.
the largest artery in the body, except for maybe the aorta, but it's so internal you can't feel it. So it is the easiest place, the biggest artery to be able to feel for a pulse. You're going to use your fingertips to feel for a pulse for a few seconds. And it does say there the largest artery is the femoral artery. It's the closest to the surface as well, so it's your best chance to feel for a pulse. If you cannot feel for a pulse, this pet is not breathing and has no heartbeat and is in situation 3 in need of full CPR. So to see that all the way through once, this pet I find unresponsive on the floor. I'm going to approach from behind and stomp my foot on the ground so they feel the vibrations. Hey pet, are you okay? I get no response. I'm going to come up, put one hand on the chest to feel if I feel any breathing or rise and fall of the chest or heartbeat. I'm going to check here. I'm going to look, listen, and feel. See if I have breathing. It's not there. Slide my right hand into the groin and feel for a pulse. I don't have a pulse. So our primary pet assessment can be done literally in 3 seconds or less, or 3 to 5 seconds. And I'm just going to ascertain ABCs, airway, breathing.